So Deborah, you have talked about personal problems and practical problems. What about health problems for Chinese students?
Yes, that's a good question, because I understand from what you've told me that the health services here are very different from China. Let me tell you how, as a normal British person, I access health care. Like everybody in Britain, almost everybody in Britain, I'm registered with a GP. A GP stands for General Practitioner, and that doesn't mean a lesser job. They've had to train for a very long time to become GPs after their basic medical training. They have to do extra training to be a general practitioner or GP or family doctor, because they have to be able to identify a lot of different illnesses and diagnose and refer appropriately. So the practice here and the expectation is that, like me, a student who is unwell will go to their doctor. We don't tend to go to the doctor with small things. If I have a cold, I know there's no cure. I know I've got to drink lots of fluid, take paracetamol or aspirin, or ask my chemist, the pharmacist, for advice, because they're trained to help with low-level illnesses. But we don't go to accident and emergency for minor illnesses, only if it's an emergency. But what a student should do is just what I do, which is go to their GP. And we do encourage students, in fact personally I would advise students that they should register with the University Health Service. That is a proper general practice, just like mine, with one advantage for students is that it's only for students. These doctors are specialists who've chosen to work with students around the university. In fact, my own daughter was a student here, and she chose, rather than register with the same doctor as me, she chose to register with the University Health Service because she feels that they understand her needs as a student so well. Of course, you can choose a different doctor, but my own daughter is so impressed with the University Health Service that she's happy there and will be unhappy when she has to leave, when she finishes being a student. But that's the usual thing to do. You do have to make an appointment, and I know this is unusual for Chinese students. It's very usual for us. If I want to see my doctor, unless it's really an emergency, then I expect to make an appointment. The difference with the University Health Service is that if you ring up early in the morning, or if you go online the night before, you can get an appointment for that day. You have to have a PIN number, so that because they don't want me making appointments because I'm not a student. So you have to have your PIN number as a patient, and then you can get an appointment really quickly. The doctors can do things like write medical notes if you need it. If I ask my doctor for a medical note, she does make a charge of £25 because that's the usual thing. University Health Service you don't pay. And the advantage of going to the University Health Service is that you can see the same doctor more than once usually, somebody who gets to know you. They understand about being a student, they understand about the stress of being a student and how important studying is to you. So I would always recommend students to register with the University Health Service and just think ahead a little bit and make appointments 24 hours in advance of when they need to see the doctor. Of course, if it's an emergency for that day and someone is really ill, then they can go. Most things, the doctor can prescribe the right medication or treatment. If you need to see a specialist, the doctor will know the specialist you can go to and will make a referral for you, send you to that place. But we never refer ourselves to specialists in this country. I have seen many specialists in my life for various conditions, but always my GP has sent me to the expert in that medicine if they can't help me. But usually the doctor can help me with most conditions, most illnesses.
So does the University Health Service cover dental care or sexual health care as well?
Sexual health care it does. There's a specialist practitioner there for sexual health, and by that I mean things like contraception, because I know that that's not something you talk about a lot in China. But we also know that Chinese students, sometimes this causes problems because they haven't been aware of how to avoid pregnancy, but for the first time their parents don't know where they are. So it's possible to, it's possible. I always tell new students, you get pregnant in this country the same way as you get pregnant in your country. Don't think it's like some holiday, it's the same thing. So you have to take the same care. But also avoiding any diseases that can come about through sexual contact. So yes, dental health, no. But they do have a list, and we publish in the diary and online information about how to get dental care. Unfortunately, it's harder and harder to find free dental care now, and most people have to go to a private dentist. But it's usually we advise going twice a year for a checkup, just to make sure everything's okay before a problem gets bad.
Okay. So what happens next when your GP gives you a prescription?
Okay. If the GP thinks you need drugs, and sometimes they won't, sometimes they'll say, you've got a cold, there isn't a cure, but you must look after yourself. Just go and buy some aspirin and go to bed for a couple of days and be kind to yourself, make lots of hot drinks. But if they give you a prescription, you usually have to pay, it keeps going up, it's nearly £8 now I think. But you take that prescription to any chemist that has a pharmacist, which is most of them. There's one just underneath the University of Health Service, and there's one at Boots, very nearby, or anywhere else. And you take that prescription and give it to the chemist, who will make up the drugs that the doctor has prescribed. They usually write on the outside, it might say something like, don't drink alcohol, or don't drive a car when you're taking these. And sometimes the chemist will ask you, are you taking anything else, or have you taken this before? And they might have a chat with you about it. But they won't discuss your illness in that public place.
Right. And this chemist is not someone who studies chemistry, right?
Very good question, isn't that? Because I've just said use two words in the same way, a chemist and a pharmacist. Yeah, I mean a pharmacist, but it's a good question because I grew up always talking about going to the chemists. That's I guess that's the old-fashioned word that I grew up with. So many British people still say, go to the chemist for a prescription, but don't go to the chemistry department because they'll think you're a bit stretched. So yes, you go to a chemist shop or a pharmacist, and these always have, I think, a green cross. It's green cross, isn't it? Yeah, outside. And there'll be a desk for pharmacy. Often those pharmacists, I'll try not to say chemist, but those pharmacists are very knowledgeable. They get extra training in how to prescribe for minor illnesses, not to prescribe but to give drugs for minor illnesses. And I should say, I'm not suggesting this is going to be a problem for everybody, but sometimes if somebody thinks they might have become pregnant the night before, there's also something called the morning after pill, which is you can go to any chemist, pharmacist, and just ask for the morning after pill, which if you think you might have got pregnant and don't want to be, you can take this pill the next day, and it will prevent the pregnancy.
Right.
Though, as we say, prevention is always better than cure.
Yes. And I heard that the University Health Service also provide free morning after pills and condoms.
They do, yes. If somebody wants to avoid a pregnancy, they can get any kind of contraception. They can get condoms for the male partner, or they can get morning after pill if they've forgotten to use contraception, or they can ask. Obviously, most female students are going to be in a committed relationship, so they know this is something that's they're going to need to think about for a long time. They can ask for other kinds of contraception that they can take charge of, where they can have pills or even contraceptive chemical which can be inserted into the arm, so if you forget, it doesn't matter. There's all sorts of different contraceptives that they can discuss in confidence with someone, and again, that doctor or nurse is not allowed to tell anybody in the university, not allowed to tell another student, and not allowed to tell your mum or dad. which is most important, I think, you know that it's completely confidential.